Unraveling Basic ID, Key to Lazarus Multimodal Therapy. Embark on a journey into the fascinating world of human behavior and psychotherapy, where insights from Arnold Lazarus Multimodal Psychotherapy model illuminate the path to understanding and transformation. From seasoned psychotherapists to curious minds eager to explore the intricacies of the human psyche, Basic ID stands as a beacon of insight and possibility. In this exploration, we delve into the foundational concepts of Basic ID, unraveling its mysteries and revealing its profound implications for both clinical practice and personal growth. Join us as we bridge the gap between professional expertise and everyday curiosity, unlocking the keys to effective psychotherapies and unlocking the secrets of the human mind. Basic ID is an acronym that encapsulates 7 modalities through which individuals experience and express themselves. Each letter represents a different aspect of human functioning, encompassing both internal processes and external behaviors. The components of Basic ID are as follows. 1. Behavior. 2. Affect. 3. Sensation. 4. Imagery. 5. Cognition. 6. Interpersonal relationships. 7. Drug/biology. These modalities interact dynamically and influence one another, shaping an individual's thoughts, emotions, and actions. Lazarus emphasizes the importance of considering all these modalities to comprehensively understand a person and tailor therapeutic interventions effectively. Let's consider each modality in some detail. 1. Behavior. Behavior encompasses observable actions, both overt and covert. It includes behaviors such as facial expressions, gestures, habits, and speech patterns. In therapy, focusing on behavior helps identify maladaptive patterns and develop strategies for change. 2. Affect. Affect refers to emotions and feelings experienced by individuals. It encompasses a wide range of emotional states, including joy, anger, sadness, fear, and shame. Exploring affective experiences provides insight into underlying psychological processes and motivators. 3. Sensation. Sensation pertains to physical experiences, including sensory perceptions such as touch, taste, smell, sight, and hearing. Sensory experiences can evoke emotional responses and influence behavior, making them essential considerations in therapy. 4. Imagery. Imagery involves mental representations or pictures created in the mind. It includes visual, auditory, olfactory, and tactile images that individuals generate, often influencing emotions and behaviors. Exploring imagery helps uncover unconscious processes and entrench belief systems. 5. Cognition. Cognition encompasses thoughts, beliefs, attitudes, and perceptions. It includes cognitive processes such as reasoning, problem-solving, memory, and interpretation of events. Examining cognitive patterns helps identify cognitive distortions and dysfunctional thought processes. 6. Interpersonal relationships. Interpersonal relationships refer to the dynamics and interactions between individuals and significant others. It includes relationships with family members, friends, romantic partners, colleagues, and authority figures. Understanding relational patterns sheds light on interpersonal difficulties and attachment styles. 7. Drug/biology. The drug/biology modality considers biological factors, including genetics, neurochemistry, and physiological processes. It also encompasses the influence of medication, substance use, and lifestyle factors on mental health and behavior. In Lazarus Multimodal Psychotherapy model, therapists assess clients across all Basic ID modalities to develop a comprehensive understanding of their presenting concerns and treatment needs. The assessment process involves gathering information through interviews, questionnaires, observations, and standardized measures. Based on the assessment findings, therapists collaboratively formulate treatment goals and select interventions tailored to the individual's unique profile. Multimodal interventions draw from diverse therapeutic approaches, including cognitive behavioral techniques, experiential methods, psychodynamic exploration, and behavioral experiments. The flexibility of multimodal psychotherapy allows therapists to adapt interventions based on the client's preferences, cultural background, and therapeutic goals. Treatment progress is continually monitored, and interventions are adjusted as needed to address emerging issues and promote sustainable change. Let's consider the use of the multimodal psychotherapy to a hypothetical case. Intake summary. Client information. Name: Sarah Johnson. Age: 28. Gender: female. Marital status: single. Number of children: 2, ages 4 and 6. Presenting concerns. Sarah Johnson, a young single mother of 2 small children, seeks treatment for her long-standing struggle with depression, which has plagued her since her early teenage years. She reports experiencing persistent feelings of sadness, hopelessness, and worthlessness, accompanied by recurrent panic attacks characterized by intense fear and physical symptoms such as heart palpitations, sweating, and shortness of breath. Developmental history. Sarah's depressive symptoms have manifested across various developmental stages of her life. During her teenage years, she exhibited signs of withdrawal, loss of interest in previously enjoyed activities, and disrupted sleep patterns. As she transitioned into adulthood, her depression intensified, impacting her ability to pursue higher education and establish stable interpersonal relationships. Despite her efforts to seek employment, she struggled to maintain steady employment due to low energy levels and impaired concentration. Additionally, her depressive symptoms hindered her engagement in recreational activities and dampened her sense of spiritual fulfillment. Past psychotherapy treatments. Sarah has engaged in several psychotherapeutic modalities, including psychodynamic psychotherapy, attachment theory, and Gestalt therapy, in an attempt to alleviate her depressive symptoms. However, despite her participation in these therapeutic approaches, she reports minimal relief from her depressive symptoms. While she gained insights into her early childhood experiences and attachment patterns, she continues to grapple with the pervasive effects of depression on her daily functioning and overall well-being. Medication history. Sarah has been prescribed selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines to manage her depressive symptoms and panic attacks. While she acknowledges experiencing moderate relief from these medications, she remains dissatisfied with their efficacy in addressing the underlying causes of her depression and anxiety. Provisional treatment plan using Lazarus Multimodal Psychotherapy. Assessment. Conduct a comprehensive assessment of Sarah's presenting concerns, including a thorough exploration of her depressive symptoms, panic attacks, developmental history, past psychotherapy treatments, and medication history. Basic ID exploration. Use Lazarus Multimodal Psychotherapy model to assess Sarah across the 7 modalities of basic ID: behavior, affect, sensation, imagery, cognition, interpersonal relationships, and drugs/biology. Identify specific areas of distress and dysfunction within each modality to guide treatment planning. Results of basic ID exploration. Behavior. Sarah exhibits avoidance behaviors, including social withdrawal and avoidance of previously enjoyed activities. She also displays disrupted sleep patterns, with frequent insomnia episodes contributing to daytime fatigue and lethargy. Affect. Sarah reports pervasive symptoms of sadness, hopelessness, and worthlessness, which significantly impact her mood regulation and emotional well-being. She experiences intense fear and anxiety during panic attacks, characterized by palpitations, sweating, and trembling. Sensation. Sarah describes physical symptoms such as muscle tension, headaches, and gastrointestinal distress associated with her depressive and anxiety symptoms. These somatic complaints contribute to her overall distress and impairment in daily functioning. Imagery. Sarah experiences intrusive negative imagery related to past distressing life events, contributing to her symptoms of helplessness and despair. She visualizes scenarios of failure and rejection, exacerbating her anxiety and depression. Cognition. Sarah demonstrates cognitive distortions, including negative self-talk, self-blame, and catastrophic thinking patterns. She holds pessimistic beliefs about her self-worth, capabilities, and future prospects, which perpetuate her depressive symptoms and exacerbate her anxiety. Interpersonal relationships. Sarah struggles to establish and maintain meaningful interpersonal connections, citing difficulties in trusting others and expressing her desires, wishes, and emotions. She experiences interpersonal conflicts and feels socially isolated, further exacerbating her sense of loneliness and despair. Drug/biology. Sarah's depressive symptoms and panic attacks may be influenced by neurobiological factors, including genetic predisposition, neurochemical imbalances, and hormonal fluctuations. Pharmacological interventions may provide symptomatic relief but require careful monitoring and integration with psychotherapeutic interventions. Treatment goals: reduce the frequency, intensity, and duration of panic attacks by implementing relaxation techniques, mindfulness practices, and cognitive restructuring strategies. Improve Sarah's mood regulation and emotional resilience through emotive interventions from second-wave behavioral models to improve emotion regulation skills training and expressive arts therapy. Aid Sarah's development of unconditional self-acceptance and self-efficacy by challenging and replacing dysfunctional self-perceptions and promoting self-compassion and self-care practices. Foster assertiveness, forgiveness, and effective communication skills to navigate interpersonal relationships and establish healthy boundaries with others. Address sleep disturbances and enhance sleep hygiene practices to improve Sarah's quality of sleep and overall well-being. Identify, challenge, and replace maladaptive inferences and beliefs contributing underlying Sarah's depressive symptoms and anxiety. Multimodal interventions. Cognitive behavioral therapy, CBT, implement cognitive restructuring techniques to challenge negative thought patterns and replace them with adaptive and realistic thinking. Conduct behavioral activation exercises to reintroduce pleasurable activities and increase Sarah's engagement in rewarding experiences. Interpersonal therapy, IPT, explores Sarah's interpersonal difficulties and attachment patterns to identify maladaptive relationship dynamics and communication patterns. Facilitate role-playing exercises and communication skills training to enhance Sarah's interpersonal effectiveness and relational satisfaction. Mindfulness-based stress reduction. MBSR introduce mindfulness meditation and relaxation techniques to cultivate present moment awareness and promote emotional regulation. Guide Sarah in practicing mindfulness exercises to develop non-judgmental acceptance of her thoughts and emotions. Experiential techniques. Use experiential interventions such as guided imagery, visualization exercises, and expressive arts therapy to access and address habitual emotional responses. Encourage Sarah to express herself creatively through art, music, or movement to facilitate acceptance and comfort with herself. Psychodynamic exploration. Explore Sarah's early childhood experiences, attachment relationships, and family dynamics to identify underlying origins of negative self-attributions contributing to her depressive symptoms and anxiety. Use free association techniques, dream analysis, and narrative storytelling to uncover her operative dysfunctional self-narrative and the role of threat and conflict in the narrative. Behavioral experiments. Design behavioral experiments to test the validity of Sarah's negative inferences and predictions, allowing her to gather evidence and challenge distorted attributions to self, others, life, and her world. Encourage her to engage in graded exposure exercises to confront feared situations and reduce avoidance behaviors. Medication management. Collaborate with Sarah's prescribing physician to optimize her medication regimen, monitor for side effects, and titrate dosages as needed. Provide psychoeducation on the role of medication in managing depressive and anxiety symptoms and address any concerns or misconceptions about pharmacotherapy. Regular monitoring and feedback. Schedule regular follow-up sessions to monitor Sarah's progress, evaluate treatment outcomes, and solicit feedback regarding intervention effectiveness and treatment satisfaction. Adjust treatment strategies based on her evolving needs and treatment response. Collaborative care. Foster collaboration and communication among multidisciplinary treatment providers involved in Sarah's care. including primary care physicians, psychiatrists, and social services agencies. Coordinate referrals to adjunctive services such as parenting support groups, childcare resources, and community-based mental health programs. By implementing a holistic and integrative approach grounded in Lazarus Multimodal Psychotherapy model, we aim to empower Sarah in her journey toward recovery, resilience, and holistic well-being. Through compassionate and evidence-based interventions, we aspire to facilitate meaningful changes in Sarah's life and foster a renewed sense of hope, purpose, and fulfillment. In the dynamic landscape of psychotherapy, the principles of basic ID emerge as guiding stars, offering both therapists and seekers of insight a compass to navigate the complexities of human experience. As we bid farewell to this exploration, let us carry forth the wisdom gleaned from Lazarus Multimodal Psychotherapy model, bridging theory and practice, science and intuition. Whether you walk the path of the therapist or the seeker, remember that within the realms of basic ID lie the seeds of transformation and understanding. Let us embrace the journey ahead with open hearts and curious minds, for in the interplay of behavior, affect, sensation, imagery, cognition, interpersonal relationships, and biology, we discover the boundless potential of the human spirit. Disclaimer: the following video is provided for educational purposes only and is not intended to offer legal, medical, or psychological advice, services, or treatment. The content presented in this video is for informational purposes and general educational understanding. While the information provided in this video may be relevant to certain topics within the legal, medical, or psychological fields, it is not a substitute for professional consultation, diagnosis, or treatment. Viewers are strongly encouraged to seek the assistance of competent licensed professionals for specific legal, medical, or psychological concerns. The creators of this video do not assume any responsibility for the accuracy, completeness, or applicability of the information presented herein. Viewers should exercise discretion and critical judgment when applying any concepts or recommendations discussed in this video to their individual circumstances. Furthermore, the views and opinions expressed in this video are those of the presenters and do not necessarily reflect the views of any affiliated organizations or institutions. By accessing and viewing this video, viewers acknowledge and agree to the terms of this disclaimer. If you are in need of legal, medical, or psychological assistance, please consult with a qualified professional who can provide personalized guidance and support tailored to your specific needs and circumstances.